Welcome back to Cerebral Palsy and Fitness Podcast, you guys. And I'm here with Daniel Komforti. He is a physical therapist and the owner of New Horizons. Welcome, Daniel.
How's it going, David? Nice to meet you.
Good, nice to meet you, man. I'm excited to have you on. And as we were talking a bit earlier before the podcast, you mentioned about I mentioned to you about your TikToks and how you're trying to promote fitness among all fitness levels, utilizing uh not just fitness but therapy incorporated in that fitness. So tell me how you got started with New Horizons.
So I started my mobile practice back in May of last year. I'm a graduate from UCF. I graduated in 2020. So I've
All
been
right,
practicing
go
for
Knights.
exactly undergrad and my physical therapy degree from there. So I'm a big Knight supporter. I've been practicing since 2020. Been in the corporate world. I've been working for Orlando Health and Jewett since then. Um, I knew back in school that I wanted to go in private practice eventually. But as I, got out of school and get my feet wet, I was kind of growing complacent, but also frustrated with, the traditional PT mills and the insurance world and limitations they set on patients and on providers like ourselves. Um, I applied for promotion through Orlando Health, and then kind of a light bulb went off in my head that this was not actually what I wanted to do. It wasn't my plan all along. And I kind of spoke to some people, and everyone told me, they wish they had
Mm.
started sooner. Like there's no right time to do it. It's never going to be the perfect opportunity. You just got to take the jump. And I decided to apply for business coaching a couple of days after applying for that promotion. And then since then, I've just been trying to grow my business, get the word out there that mobile physical therapy is an option. A lot of people don't even know
Nice.
that it exists. That includes both the general population and referring providers, doctors, chiropractors. Um, so it's been tough to get the word out there and let people know that there is another option, but it's also been really gratifying and growing that side of physical therapy in Orlando when there's not a lot of mobile physical therapists here.
And then as far as that's concerned, how do people kind of apply for something so unique as yours, being that you're mobile, um, in that sense?
Yeah. I've obviously still working on growing my clientele, but the majority of people have been word of mouth. So the first thing I did was, try to get in contact with concierge doctors, or direct primary care providers, people that, their clientele is used to paying out of pocket for a higher quality service. When you're paying cash for a service, there's a certain standard it's held to. So a lot of doctors you use your insurance for, they're in the room with you for 5 to 15 minutes. But if you're going to see a concierge doctor, they're going to be, spending 30 to 60 minutes with you, really getting to know you and really trying to help you figure out the right path to health. And I'm trying to, model my business kind of after that, where I'm very personalized and I try to really put the effort in to get to know my patients, and they don't just have
Mm.
access to me during the hour that they're with me or the 2 hours they're with me during the week. I'm concierge so that I'm available to them 24/7 by text. So regressions, progressions, if they have any questions, I'm always there for them.
I love that, man, considering that I've dabbled in physical therapy as a kid until just recently as an adult, and I realize there's so many differences between you being a kid in physical therapy as to being an adult. Being a kid in physical therapy, you have that one-on-one attention. They're willing to help you grow and every aspect, physical, mental, psychological. And then as I got older, you start feeling the sense of when you go to physical therapy, it's more of like you're on your own. You're independent. They give you a set of exercises, and they'll maybe treat you for about 2 or 3 weeks, and then they're done. Then you have to do it on your own. And I'll question myself, so you're paying all this money to see someone for 2 or 3 weeks, but then they're not readily available for you afterwards.
Yeah.
So what benefit do you get from that?
Exactly. It's no fault to the individual providers as physical therapists. It's really just the world that the insurance model makes things into. For one, you mentioned that, you see someone for 2 to 3 weeks and then you're discharged and then you never, hear from that patient again. And, they don't have an opportunity to even schedule, a 3 month, 6 month, or a year follow up. versus other
Yeah.
professions, doctors, dentists, you finish an appointment, they're booking you out 6 months. We're going to see you there. We're going to hold you accountable to the things we told you to do. And we'll be checking in on you 6 months from now. Versus physical therapy, it's here's your homework, you go do it, you're out on your own. No guidance as far as regressions, progressions. If other things pop up along the way, they kind of have to enter the system again as a fresh patient rather than, holding that relationship with their therapist. And that's something I pride myself on, is that, I keep in contact with my past patients, checking on how they're doing. If they need a tune up, I'm always available with them for that.
So what made you choose the name New Horizons for the business?
Yeah, for sure. It's a good question. So New Horizons, what's the first thing it makes you think of? Let me ask you that.
It makes you think of above, when you go above that hurdle,
Yeah,
the
for sure.
positivity. It makes you think
Yeah.
about that.
Yeah. So I definitely think that I go above and beyond for my clients, and it's something that I'm able to do because I am in private practice and I'm not, held accountable to someone above me and not held accountable to insurance companies. But more so, I named it New Horizons just as like it's a fresh start, put all the other, experiences in healthcare aside and, try something new because there is something different out there. The experiences you had before, you know, whether they were good or bad ones, this is something different.
So and the best thing about it is by you starting a mobile service, eventually the other organizations or other people will follow. And I
You
don't
cut
think
out,
I've heard
David.
of. Oh, did I cut out? Oh,
Yeah.
okay. Yeah, like other people will follow you. They'll follow your model, and I don't think I've heard of anything like this in Florida. So I think you're probably the first one I've heard about here that's mobile.
There is a couple people doing it in Florida. There's even one other guy doing it in Orlando. He has a little bit different model than me. He works primarily with Parkinson's patients, so the neurological population. Um, but actually, like I said, I got some business coaching, and the coaches that I work with, the whole program, it was when they initially started their business. I think it was like 3, 4 years ago. It was just for PTs who were trying to start mobile practices. Now they've grown above that, but there is people starting mobile practices all over the country, just trying to get out of the traditional healthcare and do things differently. Because I feel like as a mobile practitioner, and I can just serve people at a higher level and show up more authentically.
That is awesome. And like for you, like one of the questions I just thought of is, what got you into physical therapy?
Yeah. So I knew from a pretty young age I wanted to do something in healthcare. My brother is an orthodontist, my cousin's a veterinarian, my sister-in-law is a pathologist. So I've always been, pretty good at science. Wanted to do medical school, was on the pre-med route while I was at UCF, applied to some schools my junior year of college, and just didn't get into the school I wanted to get into. I
Oh,
didn't really want to go out of state because I knew how expensive it would be. So I didn't want to reapply. So I took a step back and kind of decided that I wanted to do something else in healthcare. So I took the time to shadow a bunch of different providers, veterinarians, orthodontists, chiropractors, optometrists, pharmacists. I just wanted to get my feet wet and kind of experience what I do like and what I don't like. And obviously, physical therapist was among that list of people that I shadowed. And it definitely stood out to me. What made them unique was that the 2 to 3 hours you get to spend with a client during the week versus, the 5 minutes that you see someone in your office as a doctor. I feel like as a physical therapist, you really get to develop a relationship with your clients. And that only kind of helps bring them along during the healing process and during their rehab, especially being someone who I'm pretty introverted myself, but I find that when I'm working with my clients, it brings out a whole different side of me. And it's not something that I've ever experienced other than when I'm working with patients. And I love being able to, kind of hone in on that side of me and be able to help people and not be my introverted self.
awesome. So it brings that character, your character, that emotion and that personality of yours to life, that
Yeah.
you
And I
really
had
care about
doubts. Like
people.
I had, like, when I was shadowing physical therapists during college, I was like, how can I be this social and engaging and talkative and, compassionate towards people? But like it, I surprised myself. It worked out perfectly.
Yeah, I'm still friends with a couple of my childhood therapists nowadays, you know, as now I'm an adult and they've seen me grow up. Like I had one in from elementary to high school who literally stood by me from day one to when I got here in Florida to uh, to now, you know, now that I'm in college. Or
That's
not in
awesome.
college, but out of college, and she literally like was my school mom, but she was also my therapist, and she was pretty awesome. Like she always gave me some good advice and to stay in shape and to stay active, and
Yeah, I'm
that's how I got.
huge on that, like forming a relationship with your patients.
Yeah, and we have this relationship now that we're friends now. I went to her retirement ceremony just a year ago. I surprised her. She didn't know I was coming. She's like they told me by secret. They're like, "Oh, we're she having a retirement party," and she had no idea I was coming. She was in tears. She's like, "She was my first patient, my first kid, and that I had in the 20 years I did this."
That's
And
awesome.
so now we're good friends.
That's awesome. Yeah, I mean, even like throughout my internships and the two jobs that I've worked since graduating, like I always hear from coworkers they're so kind of hesitant to give their number to or email address to patients because they don't want to get blown up or, be asked questions all the time. But if some like it's so rare that, I work for Orlando Health still, and it rarely happens that someone will ask for my personal information and my phone number. But you got to think if someone's like reaching out and wanting your help outside of the clinic, like they're brave enough to ask you for that information. Like I'm not hesitant to give it. No harm is done. If they have questions and you don't answer them immediately, but the ability to
Yeah,
let someone know in the moment that like here's my number, if you have any questions you can reach out to me. I
right.
feel like it creates a much safer space for that patient.
Right, and it's always important, like, we build that patient to therapist relationship, and with you, it seems like it's there, it's there, and you obviously care, and you're passionate about what you do, and, like, one of the question I had for you is what makes you so passionate about the profession? What makes you wake up every day and you're like, "Man, I'm so happy to do this. I'm so happy to help these clients."
Yeah, I love the problem solving aspect of it because, especially as a mobile physical therapist, I see a lot of my clients evenings and weekends just because it's most convenient for them. And a lot of these people have been putting off their issues for months just because it wasn't convenient for them to go to a clinic that's open from 7 to 5 p.m. because they work or they have kids. So, with months of putting off an issue comes months of compensations and,
Right.
chronic pain develops, and that makes those cases more complicated. So, being able to help someone that's tried different options, they've gone to a chiropractor, they've gone to acupuncture, they've gotten injections, and nothing's helped. And I'm willing to come along and really dig deep with them and figure out what's going on and try to help them. And even if I'm not able to help them 100% of the time, because physical therapy is not 100% of the solution for everyone, um, I still devote myself 110% to giving my all to try to find them a solution or help them minimize their pain.
Awesome, man. And that's really commendable. Like the fact that you take the time to get to know each client and really look out for them and see what they need and you always take that into consideration, you know, not just on a professional level, but a personal level as well.
It's a personal profession, honestly. I think people are so vulnerable when they're coming to their physical therapist. They have no idea what to expect a lot of the time. Um, a lot of times with a doctor visit, you're going to be talking to the doctor. If you're going to go get your blood drawn, you're going to get your blood drawn. If you're getting an injection, you're scheduled for an injection. You show up to your physical therapist, you have no idea what they have planned for you.
Yeah, that's right. You never know. It's a surprise every single visit.
Exactly. So they're vulnerable and they're trusting you.
So Daniel, where can my listeners find you or contact you to find like more information about New Horizons
Yeah.
and
So
to I guess inquire with you?
my website is newhorizonsrehabilitation.com. But I'm on all the socials. I'm on Facebook, I'm on Instagram, I'm on TikTok, I'm on YouTube, I'm on LinkedIn. I think I named them all. But yeah, any questions, you can DM me my personal page or on my business page. And then as far as, if you're local and looking to do a phone consult, I'm more than happy to do that for you. Um, yeah.
Awesome, man. And I'm trying to figure out how we ended up getting connected ourselves, because I remember I think you added me and then we kind of spoke briefly, and then we had I guess we followed each other for quite some time, and then I'm like, you know what? It seems like he's doing a fascinating job with the, New Horizons, so I gotta get him out there so he can influence others.
Yeah, for sure. I mean, I feel like when I started my business, I started using Facebook a lot more just to try to grow my network. So I started adding people in the fitness industry, or seen my post in the community groups.
Yeah, so it's awesome, man. So thank you for your expertise and your knowledge, and for having a big heart and for having passion to help those in our community, be feel better.
Yeah, I truly feel like as a private practice owner and as a practitioner who can give someone one-on-one attention, I can make way more of a difference than working at, one of the PT mills where they're just churning patient in and out.
That's right, man. So thank you, Daniel.
Of course, yeah, thanks for having me on, David.
And you guys, if you want to find this episode, you can find it on Spotify, iTunes, YouTube, and every other major podcasting outlet out there. And as I like to say, if if we can accomplish our goals, so can you. Have a good one. Thanks, Daniel.
All right,
Appreciate
David.
it.
Yeah, of course.